So this video is all about spinal injuries and spinal pain, okay? So if we have a look here at our spine, from top to bottom, we have the three major divisions. Cervical from the shoulders up, thoracic is attached to your ribs, and lumbar is lower back, okay? So if you have a look at the cervical spine, on top is the atlas. That allows you to nod your head. Next then is the axis. That allows you to shake your head for no, right? And the thoracic, each one of these is attached to a rib, and the lumbar is the lower back. So the weight, these discs get thicker and heavier as they get lower. Why? Because there's more weight bearing down on them. The lower they are, the thicker and the stronger they have to be. Most common injury that you hear of is the L4, L5, or something in the cervical. Those are the ones that you hear. Why? Because if you're sitting badly, there's extra loading here. If you're sitting for too long and then you suddenly move, you're at risk of pain there. And then the cervical, because we're all craning our necks to stare at our bleeding phones. And I'm one of the worst people for it, so I can't really slag other people off for bad posture, because I'm doing that a lot more than I should. Okay, so how does the spine move then? Well, first of all, it can bend like so, can't it, right? We can reach down here. Yeah, we can bend this way. Next thing, it can bend to the side, and it can twist. All right, so that's the movements that the spine can do. Now, if you imagine the structure then, each of these vertebrae sits on top of each other, okay? And each one has a layer between them. Well, it's multiple layers, right? You have your meniscus. Inside that, then there's a little fluid-filled cavity, and then you have the cartilage itself to separate, all right? So if I grind bone on bone, that is going to be intensely painful, and it's going to wear away the bones. So we got to keep those, we want those cavities to be filled with this synovial fluid, this joint fluid, okay? And motion is lotion. By moving it around, we're helping that fluid to circulate and kind of encouraging a healthy joint. But we need to be careful. If I bend it too far, or I load it too heavy and bend, I'm pressing here and I'm creating a weakness in those meniscus, right? If I bend and twist, now I can create an impingement. And the one that you hear quite a lot is, oh, I dropped my pen, I bent down and twisted to get it, and that hurt my lower back, okay? Other causes of lower back injury, I suffered for this quite a lot myself in my 20s when I was very, very silly into my karate. I used to do jumping kicks off stairs and stuff. I used to be able to bounce down flights of stairs. And surprise, surprise, I got lower back pain. Now, if I weight train and I do my stretching, I don't have any pain at all, okay? So that cuts on to our next point, which is acute versus chronic. So acute is when the pain is on me, right? When every movement hurts. During the acute phase, I gotta be careful. The number one thing that I need in the acute phase is rest. The spine needs to rest and to settle as much as possible, okay? And then the number two is we need to very, 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 very gently stretch and just explore the range of motion. If you overstretch, you're going to prolong the acute phase, all right? So it's very gentle stretching. Now we'll juxtapose that with the chronic phase. So chronic is a long-term underlying condition. With chronic back pain, what I want to do is gentle stretching regularly, okay? I want to strengthen up those muscles, all right? So we'll work on increasing the strength, and we've got to be very careful because a little bit too much exertion is going to put us back in that acute phase and delay progress, okay? And then it's about our sustained postures. So if I work in an office, say, 45 minutes is my limit for sitting. Regardless of what you do, 45 minutes is your limit, all right? Get up. Walk around. Even if you just get up, walk around the room, do that, sit back down again. That's okay, because it's had a little wiggle, it's had a little move. So getting up after 45 minutes and going for a walk is a good idea. The worst, people who suffer the most from it, if you're stuck at driving, stuck in a car a lot, or if you're stuck at a desk a lot, okay? So what I'm going to do now is I'm going to film the practical exercises that go along with this video, and I'll post them up straight after. So this is the theory on spine and spinal pain and lower back pain and things like that. Thanks, guys.